If you are an internationally trained nurse or a midwife, or you hold a certificate in community health nursing, or you are an enrolled nurse, or you hold a certificate in nursing assistant clinicals, and you have the intentions to relocate to practice in the UK, then these steps are for you. The NMC UK has laid out these steps that you need to follow in order to relocate and then join their register for you to be able to practice in your field. So the first thing that you need to do is to ensure that you create an account, and that account becomes your official page that the NMC will communicate to you. And once you go through the registration process, they're going to give you a PRN, which is the pre-registration number. And that is the number that will be your reference in any communication that you're going to have with the NMC UK. So in creating your account, you need to first visit the official website of the UK NMC, which is nmc.org.uk. Once you visit the website, you head over to registration, you go through the drop-down menu, and then you look for joining the register. So once you click on that, it will take you to the next stage, which is trained outside the UK or trained in the UK. And then you select on trained outside the UK. Once you select on trained outside the UK, it will now ask you, are you joining the register as a nurse or as a midwife or as a nursing associate? So depending on your field of practice, then you select which one. After you've selected that, they will ask you some questions for you to go ahead account. Once the account is created, they will ask you to upload some documents, and those documents will include your education certificates and then your NMC registration certificate. And then if you have your PIN, you will have to upload that one as well. So this is the advice. If you are currently in Ghana and you are planning to join the UK NMC register, this is what you need to do. Whilst you are creating an account, you would need to provide an English proficiency as part of the registration process. So whilst you go through creating an account, think about also preparing for your IELTS or your OET, which is going to be your English proficiency proof that you're going to provide. And so you can take maybe a month or two to begin your preparation towards writing your IELTS or your OET. And then you can, within that same time, you can also create the account and then begin to upload your documents. So for diploma nurses and diploma midwives, you would have to go through what we call the Ministry of Health clearance. And you do so by buying the forms from the official website of Ministry of Health, and then you go through the necessary signing of those forms. Once the form is ready, you return it to the Ministry of Health, and they will clear you and make sure that you can practice outside of Ghana. So Ministry of Health clearance simply means that if your training came along with any form of bond, you need to be able to serve that bond before you are allowed to practice outside of Ghana. So that is a process that you are going to go through to ensure that you do not have any requirements that you have not met that will prevent you from practicing outside of Ghana. And so that is that about the Ministry of Health clearance. So you have created your account, you have uploaded your documents, and you have started your Ministry of Health clearance. So for step 2, you need to wait for UK NMC to now contact Ghana NMC, and what they are doing is what we call the foreign verification. All that they are doing is that they want to make inquiry from Ghana NMC to ask them that, do they know this particular person, that is you? Do they know that you have been trained in Ghana? Do they know that you have this certificates? Do they know that you have your PIN? And are you active, or do you have an active PIN? Those are the questions that they are going to ask. And then once Ghana NMC confirms that yes, you have been trained in Ghana, you have the necessary skills and knowledge to be able to practice in your field, and you have an active PIN. This goes on to say that if you are currently in the UK and we know that you are not actively practicing in Ghana, there will be the need for you to renew your PIN before you go ahead with your foreign verification. So after the foreign verification, NMC UK will now send you an email. That is step 3. They will send you an email for you to now go ahead and register for your CBT and then your OSCE. These two exams together we call the test of competence. You need to pass these two exams before you can carry on or you can continue with the rest of your registration process. The CBT exam has got two parts, Part A and then Part B. The Part A is the numeracy and then the Part B is the clinical or the theory. So the Part A, which is the numeracy, has got some common questions that appear in the exams for adult nursing, nursing associates, midwifery, and then mental health nursing. However, some of the questions are very specific to your field of practice. And for the theory or the clinical, it is specific to your field of practice. I organized a free CBT numeracy class recently, and the video is currently on my YouTube channel. So you can check on how to go about the numeracy. So the OSCE is just like the component task that we do in Ghana. It has got 10 stations or 10 tasks that you need to complete. The first 4 stations are going to be linked to one particular scenario. And so that scenario could be a patient presenting with force and fracture, a patient presenting with, let's say, ectopic pregnancy. And so you're just going to be doing the assessment of that patient, and then you plan the patient's care, which is the planning stage. The implementation stage is when you now administer oral medication. And the E, which is the 4th station, is the evaluation. The evaluation is where you now hand over patient's care to maybe the doctor or the nurses who are going to oversee the patient's care from you. So that is the first 4 stations. The other 4 stations could be a performing station or a non-performing station. Performing station is where you administer maybe IM injection, maybe you administer a subcutaneous injection, or you check patients' blood glucose level. For those skills, you need to perform for an assessor to observe you and then mark you as you do it. Those are the performing stations. For the non-performing stations, you are just going to be in silence. You will be given maybe a task, let's say fluid balance, for you to now go ahead and then you complete your fluid balance. For that station, we call it a silent station because no one is going to observe you. When you finish, the assessor is going to come for the sheets and then go to mark that. So the performing and non-performing stations or the silent stations will cover 4 stations. And you have 2 more stations to go. One is going to be the professional values, and then the other is going to be evidence-based practice. Professional values is where the NMC wants to test your knowledge on how you're going to keep or how you're going to uphold the standards. So a scenario can be given that you've seen a colleague who is bullying one of the patients. What are you going to do about it? You need to ensure that you're not going to just watch your colleague, you're going to escalate this information. You need to know that you're not just going to watch your colleague, but you're also going to escalate the situation. So that is just an example of the professional values. Now, the evidence-based practice is where we know that everything that we do within healthcare profession is backed by science. And so you will be given a scenario. And the scenario could be about your patient asking you why you're going to give them paracetamol and not ibuprofen. The findings will tell you the current evidence on paracetamol and ibuprofen with respect to pain or in relation to pain. So you use those bullet points and then you educate your patients. So this makes up the 10 stations for the OSCE. Once you have been able to pass the test of competence, which is the CBT and then the OSCE, you can now go ahead and then provide your English proficiency. So that means that you need to have written your IELTS or your OET. However, if you've had the privilege to already be in the UK and you've practiced for the past 12 months, that means you practice in a health and care setting for at least 1 year. You can provide that as a reference to replace either the IELTS or the OET. That is going to confirm that you are proficient in English and you are able to communicate in English as well. And so for site, there are some requirements on how to go about using the site, which I have recorded a video on that, so you can check on that video as well. So once you have been able to pass your test of competence and provided your English proficiency, now the NMC will now go ahead with the rest of your registration process, and then they'll process your PIN and then inform you when your PIN is ready. And now you can go ahead and then look for jobs in your field. So these are the steps that has been laid out by the NMC UK for you as an internationally trained nurse, midwife, nursing assistant clinicals, enrolled nurse, or certificate in community health nursing to be able to relocate and come to practice in your field in the UK. Don't forget to leave some few likes. If you have any specific questions, please don't forget to drop it in the comment section. I'll pick that and then answer that in a video for you. See you in the next one.